Let's go ahead and get started. I'm going to show you how to quickly go over and fit the EMA-NOW. The container itself on the back part is going to have a folded instructions for use. It's going to point out the things that you're going to need. The contents of the packaging, a lower EMA identifiable by the longer stick between the two arches, and the upper, which does not have any type of pad on the top part. You also come with 6 total EMA bands, starting from a 21 millimeter size all the way down to 16 millimeter size bands. So things that you'll need that's not included in the EMA packet is going to be a hot water, preferably 185 degrees or hotter, cold water, some wire cutters, and petroleum jelly. The cutters can just be plain scissors. So what you're going to start off with is you'll want to take the 2 trays, right? And preferably what you want to start off is with the upper tray to get that fitted first. And the way you can tell that, again, the lower tray has the pads on the bottom, the upper tray has no pads. We'll take the upper tray and we'll look inside the patient's mouth. And the first we'll do is do a little bit of an exam to see if there's any tori or if there's anything that we need to worry about, any loose teeth or any bridges or any missing teeth. Once you take note of that, get an idea of the relative size arch relative to the size of the tray. Once you get that idea, you want to fit it like you would an impression tray and see what the sizing is. So on a patient this large, his tray, this tray right here as it sits, is too small. So what you're going to want to do is get an idea of how small it is, and then that's going to give you an idea of how to stretch it out once it's in warm water. You're going to take it, warm it up, and then you're going to stretch it out approximately to the size of his arch. So he's about 2 sizes a little bit bigger, so we're going to flare this out a tiny bit. He doesn't have any tori, so I don't need to do any bends on here, but if he were to have a buccal tori, you would take this, heat it up, and bend it around that tori. Once you have all the materials gathered together, what you want to do, the first step is going to be using the petroleum jelly. This jelly is going to allow you to put it around your fingers, and the trick to this jelly is going to be lathering it as much as you can around the fingers that's going to actually handle the tray. What that's going to do is allow you to handle the tray so it doesn't stick to any of your gloves. So because once this warms up and it turns clear, it's going to want to tack and stick to your fingernail. So once you get the jelly on your fingers, you warm it up, place it in warm water. I like to move it around just so that I can get the entire arch warmed up. And then again, I'm going to put pressure around the living hinge, and you'll notice that the Vaseline's working, allowing me to manipulate this and not sticking to my gloves. And all I'm doing is approximately enlarging the arch according to what his tray size is. Once you've got the tray semi adjusted to fit around his arch, you want to confirm that that's the correct size. You want to confirm by, again, seating it like you would an impression tray and making sure that it seats closer to around the size and not hitting the buccal areas. So this tray right here, what originally looked like it was going to be too small for him, now fits a little bit better. Keep in mind that this is a semi-custom fit, and once it gets fully hot, it turns clear, it's going to become more malleable and fit better around the arch. Once you've test fitted the upper tray, you're going to want to submerge it in water that's at about 185 degrees, if not hotter. Depending on the actual temperature of the water, it may take longer than 15 to 30 seconds to get it to turn to that clear. Once it's clear, it'll be ready to be molded into the mouth. So this tray is now ready to be molded, and all I'm going to do is manipulate the buccal area, manipulate the lingual side so that it can clear as I go to insert it in the mouth. And that's a tray, that's the way the tray should look like when it's ready to be inserted. So before you insert the tray back in there, go ahead and close for me. As it's cooling down, I like to do an exam to see what kind of undercuts I have and make sure that none of the teeth appear to be sensitive or fragile or mobile. And then what I'm also looking to see is what kind of undercuts I can expect, and that'll let me know whether or not it's going to have good retention. Once the tray is heated, it's ready to be inserted in the mouth, and it should still be clear as you're inserting it in the mouth. When you go to put it in, insert it as if you're inserting an impression tray, and you want to make sure you clear the buccal area, and then you want to seat the palatal area first, a little bit of the facial area, move your way towards the buccal, resting a little bit over the occlusal, and the same thing on the opposite side. Once I've got all the tray material placed correctly, I'm going to have the patient go ahead and rest for me, not biting, but resting. And what they're going to do is hold that in place for me. As they're resting on the tray, I'm just going to guide my finger around the undercuts and the cervical height of the patient to making sure it's got good fitment. So as you can see, what I like to do is I like to position the stick so that its midline is centered to the patient's dental midline, and also their skeletal midline. You want to leave it in the person's mouth for about 30 seconds or until it starts to turn clear. And as it's setting, I like to guide my fingernail around the border of the tray. What that's going to do is ensure a proper undercut and making sure that it's going to fit tightly onto the patient. And the whole time the patient's staying rested on the tray to make sure it doesn't move. With this tray still partially clear, you want to place it in cold water, allow it to completely set. With the tray in its fixed state, meaning that it's now white instead of clear, it's ready to be tried back in. What you're looking for is a nice snap to the fit, or as you're seating it, it'll grab. So what you want to do is go and place it back in, and you want to guide it back into place. And what you're looking for is a snap as I go to seat it. That snap is ideal, and what I'm looking for is engagement on both sides. I'm not asking the patient if the engagement is good. I'm actually going to physically check it myself, keeping an eye that the most of the retention you want is going to be around this hook. So that if you're able to push and move the patient's head around and it stays engaged, that's a good indicator that you have good retention. Once you have the upper tray fitted, you want to move on to the lower tray. And again, just a reminder, the lower tray has the occlusal coverage over the back part. Okay? Same thing that you did with the upper one. You want to dip it in the hot water just enough to make it malleable again, because all we're going to do is test fit. With the lower tray partially warm, all you're going to do is test fit for the right size. Want to go and open for me? And all I'm looking for is, as I place it on there, is it hitting the lingual or buccal side? And this one seems to be a good fit for this patient. Now, as I remove it, and I know that's a good fit, while I'm in there, I'm going to look at the patient, and I'm going to note that on his lower centrals have slight crowding. We're going to keep an eye on that because we want to make sure that that's not mobile at all, and we're not going to put too much pressure on that, so that way we have less adjustments later on. Also taking a look at the inside to see if there's any buccal tori to worry about, or lingual tori. This patient does not have any, and their crowns look stable. So once you have the lower tray fitted correctly to your patient, you're ready to get it warmed up for semi-custom fit. You're going to place it in the hot water, again at 185, waiting for it to turn completely clear. If you'd like, you can move it around the hot water and making sure that all areas of the tray is getting warmed up and turning clear. Once it's clear, it should take about 15 to 30 seconds. Again, you want to manipulate it nice and round, making sure that the border walls are not collapsing on itself, and it's appropriate to the patient's size. For this patient, it was actually a pretty good fit, so I don't need to open it up too much. The lingual area is also going to be nice and flared, and the patient's tongue is going to guide me closed so that it's nice and forming around the lingual area. With the lower tray still nice and clear, it's ready to be seated into your patient. Again, you want to follow the same steps as the top. You want to insert it in as if it was an impression tray, getting the buccal area cleared, getting the midlines lined up, and then put pressure on the lingual part of the centrals, the facial part of the centrals first, guiding the lingual area so that it's nice and formed around that area, instructing the patient to go ahead and relax your tongue for me. Once you get the lingual area fitted, go ahead and rest on that for me. With the patient gently resting on there, now I can easily see and move my finger around to the framework of the tray, allowing it to be guided in and molded as it's starting to set. So right now it's an off-white color. It's still able to be molded, and I can actually put pressure on certain areas where I want more undercuts. This one, I want a lot of undercut engagement onto the molar area, so I'm definitely going to put some more pressure onto that area. Have the patient continue to rest on that, and as they're resting and it's curing, what I'm also making a note to myself is that my dental midline is lined up, but the patient's midline is aimed towards the right. You want to take a mental note of that, because that's going to give you a better idea when you go to make a more permanent appliance. In selecting the appliances, you have to keep this in mind that the dental midline of the patient is off to the right, and the selection of the appliances has to mimic and allow that to happen. Once you remove it, you want to examine the tray to make sure that on the lingual area, it's got nice shaping, nice contours. Same thing on the buccal area, and that the buccal walls did not fold in on itself. Now it's ready to be placed in the cold water. With this tray still partially clear, you want to place it in cold water, allow it to completely set. as it's setting, what you'll see is that it turns white, and the areas that's still kind of clear, you can manipulate it. This is the time where you want to, if you want to relieve a certain area, which we said there was going to be the anteriors, you want to put pressure and allow it to relieve that area. And again, place it in cold water before it fully cures. With the upper and lower trays already semi-custom fitted to your patient, you want to give your patients the opportunity to fit it on themselves. Go and start with the upper one for me, please. What you're looking for is a nice engagement, just a quick review, and pulling on that hook to make sure it stays in. Same thing with the lower one. Once you hear that nice snap, again, you're going to check to make sure there's a good engagement. And now this is a critical part to help you out with your diagnosis. Go ahead and rest on that for me, please. The first thing that you'll notice is that the patient's upper midline to his nose, according to that stick, is accurate. It's straight on. This patient's lower midline is off to the right. Significant amount, about 10 millimeters according to the way the stick looks. That's going to give you a better indicator of what type of device to use if you were going to use a long-term appliance. Now moving forward, what you want to do is you want to get an idea on a patient like this, a little bit more complicated to get a good measurement. But what I'm looking for right now, his alignment, the way he's biting down, he's at 21 millimeters according to the scale that I'm looking at on the lower stick. So what you're going to do is look at him on the side and see if that's a position that you would like. Also noting that letting him rest, he can't keep his lips closed. That not having your lips closed is a good indicator that you're going to have to adjust the vertical. This is too much vertical for him that he can't relax his lips. At the same time, what you want to do is look for his face to see if the muscles are tense, right? And at this vertical, right now, I can tell you that those muscles, his masseters, are nice and tight, which also indicates there's too much vertical involved in that tray. Go and open for me. With an idea of how much vertical is necessary or not necessary with this patient, I know that I need to adjust the occlusal pads. So before I do so, I'm going to have the patient close again, and I'm looking to see, are they biting equally on those occlusal pads, which this patient is. So I know that however much vertical I adjust the posterior pads, I need to adjust it equally on the left and on the right side. Once you've determined about how much vertical you're going to reduce from this patient, you're going to want to adjust the occlusal pads equally as much as possible. You're also going to need, after it's adjusted, articulating paper to determine that the balance of the occlusion is going to be correct. So all you'll need is an acrylic burr at a slow speed and slowly trim down the occlusal pad. Keeping in mind that the occlusal pad is 4.7 millimeters, so you have a decent amount of adjustability that you can actually conduct on the device itself. This patient had a hard time getting a good lip seal, so I'm actually going to reduce this down about 2 millimeters. Now, if you wanted to, you can easily measure the thickness of the occlusal table once you reduce it down versus what it originally was, which is 4.7 millimeters. This patient, I'm going to cut it down in half, and I'm going to continue to trim it down nice and level. Now, this is just a rough trim. You're going to do your final trimming once you've got an idea of how much vertical you have. Okay? Once you've got one side done, you want to complete it the other side same exact way. One thing that you'll notice is this patient did not need that much vertical just based on the amount of lip seal that the patient wasn't able to get. So I'm actually reducing this device down pretty aggressively. All right. That looks about equal on both left and right side. Don't worry about the rough spots. We're going to adjust those in a little bit. All right, so the next step is going to be to try it on the top tray again, making sure that, again, the patient is able to put it back in his mouth. Looking for that engagement as he inserts it in there. Same thing with the lower one. Perfect. So now with the appliances in place, what I'm going to do is just check to make sure that the adjustment that I made over the occlusal is going to be even. I'm going to have the patient just go ahead and rest on that for me, please. And tap, tap, tap. Open. Close. Move left and right. Open. And what I'm looking for is nice, even contacts on both left and the right side, and that's what I'm seeing there. So now I confirmed that the patient's adjustment is been balanced. Go ahead and close for me. And now what you'll notice is how close his lips are together, minding that the sticks are still in place. Now we're going to cut the sticks once we get the right length of the bands determined. Once that occlusion is already determined and you've seen that the patient's able to get a good lip seal, the next thing is just to figure out the band size. And that's where these sticks come into place. What you want to do is, even though this patient's sticks are not lined up correctly, what you want to do is just hold them together and get an idea with a ruler on where he's actually positioned. And where he's at right now is at 21 millimeters. Can you bring your lower jaw forward for me a little bit? As he's bringing his lower jaw forward, go as far as you can. So this is letting me know the most he can move is 7 millimeters. Go ahead and relax for me. But at his relaxed position, go and open and close. At his relaxed position right now, at the current vertical, he's at 21 millimeters. So if I wanted to be conservative in my treatment, I would leave him at 21 millimeters and put a band of 21 millimeters on there. And what that'll do is position his mandible relative to his upper to be about 1 millimeter behind edge to edge. If that's not the position that you want, go and have the patient bring lower jaw forward. Go and hold still for me. And let's say that's the position that you would like. You would look down at the scale and determine that that position is 4 millimeters less from 21, which would make it a 17 millimeter band. Go and open. For this patient, go and close. I'm going to go with their most relaxed position at 21, and I can always titrate forward as needed. Once you've determined what band length that you'd like, and you've determined that the occlusion is now balanced between left and right, you're ready for the final step of the device, which is basically cutting off, using your wire cutters to cut off the sticks, making sure it's nice and smooth. Feel free to adjust this area with a burr, acrylic burr, just to make sure that's nice and smooth. Cut off the lower one as well. Again, feeling around to make sure that there's no sharp edges that will cut the patient's lip, and it's ready for final assembly. And for this patient, we're going with a 21 millimeter band. What you want to do is position the band so that the numbers are facing outwards or towards the cheek, hooking on the lower, connecting onto the upper. And it's critical that the next step, you grab the exact same band length, also 21 millimeters, placing it with the numbers facing outwards. Once you've got the band positioned in place, you want to confirm that the numbers are facing outwards. 21 millimeters on the left side, 21 millimeter band on the right side, also facing outwards. It's ready to be inserted into the patient's mouth. The last and final step is having the patient insert the fully assembled device. With the EMA-NOW properly fitted on the patient, what you're looking for is the patient's able to get a good lip seal and that their muscles are nice and relaxed. With everything in a position, your final check is going to be making sure that the rubber bands are not overly stretched and they're not compressed. Once you've confirmed everything, have the patient look straight forward and check in to make sure that you have a good lip seal and the patient is comfortable.